Niksuukkuaukak, nistuakouk, Makiinima, Okia, Kanna. Anakaak umkitapio, anakaak sitapio, Okanakaak eitsiipujo. Miksi mohkutuuks kääks, muksi apouttumuukiiks. Anstsi nukanist suks kaatis pinnaan nistoot kehe huekaa piinaps kuhsinnaani. Nuhaamusti ne daapuutaksinaan. Sauke aamusti nistaskei siikakstimatuh pinnaan. Nuhaamusti spiapuaq kohpamuhka. Maan istsiistumsin. Oukia käätäpien joka mateituhtsimiiksi. Ki stoa kamitstiski aamukit seppumitusta piitsispaa mukaan napipuuksen aamu ne taakukstuhpiiksi tämästä siipuik. Kitskini pua kidagitsis sinjuutuuks pua kidagitsis saaksu puja peistamat sohpinnaan. Maanstapanissinen muusnaa piipuuksista. Okei, hiikoakin ohkiit spiapuavakoppaakin. Ikstönnet siikaakin maajan muuksi apoutumuukiiksi. Okei, muuksi asukinakiiksi. Muuksiska ei tapoutakiiksi mukaan sukinaksi. Okei, kiistunnuun muuksi ei tapoutakiiksi. Okei, aamuksista mukaan ei tumanista spumpstaa. Iksukapuutsimia kitäkohtakki supuja peistamat sohpinnaan nuhaamuan nuhmaanista pihpi. Nuhanista suksiksemista tuhpinnaan oikeamusti nuhanista tuhpinnaan hakanesti hutsupuja piitska tuhpa muhka maanista siistupse. Members of the Ghana blood tribe, the council and our staff decided that I should become involved more so in informing you of the developments that have occurred, that are occurring, and perhaps some of the additional decisions that the Chief and Council have to make over the next few weeks in order to combat the COVID-19 pandemic that is upon us. Luckily, no one has tested positive for this disease. Many people have been examined, have received tests, and I think we are all trying to follow. We're all trying to follow the very good advice that is being given to us by our health professionals, our frontline workers, our staff here at the administration, and of course, our people with the other entities. We also want to thank our staff and frontline workers, our medical professionals and healthcare workers, our volunteers and neighbors, our friends from the business community and from other governments. We have previously informed you of our initial decisions regarding the declaration of our tribal state of emergency for the Ghana Blood Reserve. And we issued a similar video address by myself on March the 16th. On March the 16th, the Chief and Council decided to call for a tribal state of emergency, and the Blood Tribe Administration and related operations closed the offices except for essential services. Our Chief and Council provided $500,000 from our own sources of revenue towards the emergency measures to protect our people from the pandemic, Included in that amount were the contributions from BTAP, from Kainai Resources, Inc., and from some of our business friends, such as Indigena Capital and Tamarack Valley Energy, as well as others. We also utilize the savings from our own procurement initiative that we have managed over the past 2 years and involved most of our departments and entities. These monies are to provide for necessary cleaning and basic food items for the members of the Kainai Blood Tribe, including those that live in Lethbridge, Calgary, and neighboring towns and areas. We also instituted a travel ban for the Chief and Council and employees except for essential travel. I and members of Council and our SCO made video addresses to the media and our public at that time. On March the 17th, the Red Crow College closed both the Standoff and Lethbridge campuses, and the BTA departments and entities had an emergency COVID-19 meeting. BTA essential services continued with modifications for staff and public safety. The Kainai Peacemaking Program and other operations were also canceled or temporarily closed down. The BTA departments and entities met and began to prepare for the distribution of packages to our members utilizing a priority system. On March the 28th, daily briefings began with the Director of Emergency Management. Such operations as the Bottle Depot closed down until further notice. Preparations for quarantine beds began with the Kainai Healing Lodge. The KB offices were temporarily closed. Preparations began for food packages to be distributed according to the priorities established. March the 19th, daily briefings with the Director of Emergency Management. The Moses Lake Shelter moved to the Moses Lake Hall for the safety of the clients. The Blood Tribe Pharmacy is limited on product quantities. The Blood Tribe Housing issued preventative maintenance information for blood reserve tenants. March the 20th, daily briefings again. Moses Lake Shelter, March the 20th, daily briefings again. A Chief and Council meeting. Rick Soup, our SCO, was officially appointed as the Director of Emergency Management, with Nadine Tailfeathers as the assistant. Social Development, modified service delivery to ensure safety for the staff and clients. 140 emergency food packages were delivered along with important information packages. The Blood Tribe surveying began for households in order to determine tenant counts. The Blood Tribe Land Management modified its service delivery for safety purposes, and notices were sent out. March the 21st and 22nd, the mobile medical unit was deployed for Moses Lake, Laverne, and Standoff. A state of emergency update was given addressing travel and outlining safety and other additional measures. March the 23rd, we had a Chief and Council meeting where we discussed the developments of the safety measures that we had undertaken, and to look at what we needed to decide on in order to ensure the safety of the members. Again, daily briefings occurred amongst the staff. March the 24th, food packages are being prepared. The mobile medical unit will be in communities every weekend until the end of April. That is for Moses Lake, Laverne, and Standoff. Again, March the 25th, daily briefings occurred amongst our director and the departments and entities. There will be a delivery of 150 emergency cleaning and food packages. And it was decided that I should give you this update in order to address, hopefully, some of the questions you may have and why we have decided to take these measures. There was some concern over travel by chief and council and staff. Those people do not have the virus. There was some concern as well initially about a conference that was held in Calgary. However, there was nobody was affected. The people and our elders who were there were not affected. Sometimes information is given out by others that perhaps is not quite factual. And that is why we decided that we want to keep you updated through the video, through the notices that have been going out. You have been informed. Hopefully, we will do more and more, take more measures in order to provide for your safety and ensure that the pandemic and the virus do not affect our people. Many tests have occurred to our people, and all our people are still safe. But we have to listen to our medical professionals. We have to listen to our experts. We have to listen to our emergency people to ensure that we remain safe. This is probably one of the last times that I will be at our council chambers. There's only a few of us here. We have instituted a new system in order to conduct our meetings. We will be having conference calls, and hopefully we will be able to make the necessary decisions as we move along. Again, I want to thank all of you for being brave, for listening to the important information that we are being given. So with that, I want to have Rick perhaps say a few comments. I know I've missed giving you some information. Rick is our director for emergency management. Okay, Rick, maak zo.